And then the good news is that our raw materials are locally sourced here in Ghana, and we locally manufactured them here in Ghana. And then we recycle some of our resources for some of the features of the wheelchair. We have nationwide repair and maintenance network. And then this is our manufacturing site here in Kumasi. So these are women at work at the words. Maybe after the presentation, when there's time, I will show how the product works. So these are our target market. People who are mobility impaired. People who are mobility impaired and users in Africa. And with about $4 billion for our serviceable end users in Africa. And with about $4 billion for our serviceable addressable market, about 10 million users in sub-Saharan Africa. And with about $2 million for our serviceable obtainable market, about 5,000 users here in Ghana. For our traction, we've been able to service, or 48 people with disability has been able to benefit from our products. We've been able to partner with 17 hospitals in Ghana. And then we obtained a grant of $16,000. Not just that, we've used about 6 months for community engagement and intensive research to come up with this sustainable solution. For our business model, we're going to use a direct style, the service and maintenance contracts, customization and modifications, and then spare part and battery replacements. So these are our go-to-market strategy. We're going to use a direct partnership, the media, and then the hiring system. And these are our estimated roadmap from 2026 up to 2035. With a financial projection of about $1 million, it is estimated to use it in these areas: product development, manufacturing, marketing, team operation, go-to-market, partnership, regulation, and certification. Not that we've not started, but to enhance in these areas. And let me introduce to you my wonderful team. We have Job as a CEO and myself as a Chief Operating Officer, and we have Sewa Deborah, Saeed Mohammed, and then Prisla. Let's build a future together. Thank you. If time will permit me, just a few seconds to demonstrate how our wheelchair works like. Max, please, can you help me out with that? So this is Max, one of our team. He's part of us, and through our innovative initiative, he's been able to acquire a job from AutoEase, benefiting also from the product. He's going to demonstrate to us how the product works like. So this is an electric wheelchair. It's actually an electric wheelchair with advanced features, like I mentioned earlier, like reclining features, adjustable seats, and then the joystick for movement, and then the speed. Yes. So a quick demonstration how it works. Yeah.
Kwame, nobody was pushing me because, but initially when I was, before me, coming to the university to have access to this machine, before you can go to a certain place, you need someone. Oh, Charlie, can you come and then help me? I mean, those kind of things. You can sometimes call someone and be like, oh, man, I'm tired. You can't. So you always move, in pairs. But now I can move by myself, go to any places that I want without any, difficulties. So, yeah, very happy to demonstrate into this one. Thank you so much.
All right, so we shall take some questions from the panel of judges.
Okay, so I want to say congratulations for what you have done so far. I'm so proud of you. Please put our hands together for her. I remember very well when we had the first SBS when you were part of this, and today we are seeing the reality of what you have done. And I'm also convinced from what Lam said this morning about from the Great Hall to the Impact Building. We are seeing the impact today. Congratulations. My question to you is that I can see how much you want as many people of this of our friend to use this machine. How affordable is it going to be? And how willing are you making sure that everyone else who is in this state have access to this and they can use this?
All right, thank you. So we put all this into consideration because we are here to serve. So we put into consideration the costs. Our wheelchair is as cheap as not just any wheelchair, electric wheelchair with AI-powered features, as low as 7,000 cedis, 8,000 Ghana cedis, not above that. You can get a wheelchair. And then, not just that, we have payments plan for people who are willing to buy. Sometimes the person can say, oh, I do not really need it for a long time, but maybe for a short period. So that's where the hiring system came in. Then we hire it out for a period of time. Then, yeah.
Hello. Yeah, congratulations. And this is a good innovation. My only concern was in Ghana, people living with disability, you quoted as 5,000 individuals. Yes, so what do you have to say about that, and how much can you scale this product, outside Ghana as well? Thank you.
Please, I didn't get.
So in your presentation, you
Yes.
quoted that people living with disability, 5,000 in number. Yes, so that means after selling this product to at least maybe 90%, maybe 4,000 people, how do you intend to continue making money out of this product? Do you intend to move outside Ghana to scale this business, or you only intend to stay within Ghana?
No.
Yeah.
Like I mentioned earlier, we are providing solution for Africa and even beyond. So not just Ghana. We are aiming higher. So not just Ghana, because probably someone may need our help, but not in the country. Why not? We can help you outside Ghana. So we are aiming to enter into Africa and then the international markets.
Thank you. That's a very great idea, especially the business model that you put forward. My question has to do with probably to TK's one. 7,000 compared with other competitors, how it stands. And second has to do with financing. If it's probably the most competitive based on how you respond, how the financing will be. Probably are you looking at probably some of the disability funds, some banks and other institutions that tries to help in mobility to raise up with them. Thank you.
So I mentioned earlier, we are open for partnership because we know we cannot do this alone. We need partnership with some NGOs, health service, banks, anyone that is willing to partner to make this impact that we are trying to create in Africa go very far. So in as much as we are considering the affordability, once we are able to partner with more organizations, we'll be able to travel very far. Thank you.
Okay, Rita, is that the name?
Yes, please.
Okay, how are you?
Doing well.
I didn't hear anything. A beautiful build-up material. So I'm coming to ask that. Your source, you said, is local materials. How long does it take for you to get this material, and how long does it take to produce one chair?
Okay, so what happens is that with the sourcing of the materials locally, we can get them within a day, provided the resources available. We just get them, and then we start manufacturing. And then with estimated manufacturing time or period for a wheelchair, mostly we produce them in bulk. So when after maybe doing the parts, different parts with the assembly, in a day we can assemble more than one wheelchair. Once the parts are ready, we cut, everything is designed, we go strictly according to the design measurements. So we give roles among ourselves, so we know that you are doing cutting, you are doing drilling, you are doing this, so it makes the works faster. And then in a day we can assemble more than we even expect in a day, like more than one wheelchair in a day.
All right, thank you very much, Rita. We have a very special request. Mr. Caleb Barome would like to ask a question, just a quick one.
Thank you.
Incredible success story. My question is simple. How many people work at your factory? How many people are currently in your employment?
So currently, we've been able to employ 9 people. Sorry, I forgot to mention what's the slides. We've been able to employ 9 people, including persons with disability.
Thank you very much, Otto Ease. Please, a round of applause for Rita. Innovation, they are there. Job creation, they are there. Sustainability, they are there. And they have plans to do bigger and better. Let's give a bigger and better round of applause to Otto Ease. And now we delve into one of the main reasons why we are here. We have seen our ventures around, and maybe we have gotten the opportunity to interact. But now we get to hear from them properly. We get to know what they are doing and what they can offer us. So to moderate this session, shall we, with a round of applause, invite Ms. Fridiani Savine. A round of applause, please.
Good afternoon. The moment I know 6 ladies in the room have been waiting for. So we're not going to hold the suspense for much longer. We're going to start with the FemSTEM session. So it's really a pleasure for me to be the moderator for that session. And as you know, FemSTEM is an opportunity to empower the women in FemSTEM, to give them a space where they can show us their innovations, the solutions that they apply to the problems that they're solving. This session is also an opportunity for them to interact with judges that also gives them an experience of what they could experience with investors when they meet them later on. So there's multiple facets to that session, which is really important for them, but to you as well, to learn more about these ladies. Today, to assist in this contest, there's going to be a winner who can have the chance to win a $15,000 cash prize. And the second runner will have $5,000, and the second runner-up $5,000 as well. And all winners will receive service kind grant for $5,000 Canadian. And our partners in this program is Sustineri Attorneys, a legal firm that's going to be providing the service for the legal grant. Let me introduce you to the 4 judges that will help us today select the winner of that SEEK competition. First, we have Dr. Bravana Singh, who's the Chief Medical Officer, University Health Service at KNUST here. You all know her. She doesn't need an introduction. The second judge, who's Prof. Ernest Asamoah, Program Officer for West Africa Office of the Vice President, International University of Toronto. Thank you. Our third judge is Professor Ibok Oduro, Professor of Post-Harvest Technology at KNUST. And our last judge is Dr. Isaac Twenboa Kodu. I'm sorry if I didn't tell your name well. Who's the CEO of Hypax Services. So now let me introduce you to our 6 finalists. I must say that this year the competition was tough. It was very difficult. We received more than 100 applications. So for these 6 women to be here, it really means that they're like crème of la crème, if I may say that French expression. So congratulations to all the people who applied. You're all winners because making the first step to go into a FemSTEM and apply to a program, that's already a big step. But again, we have 6 finalists from this selection process. So I'm going to allow them to have 5 minutes each to present their ventures. After 5 minutes, the judges will also have another 5 minutes to ask them questions. Okay. And after those sessions, the judge will go and deliberate and will come back later to find out who's the winner. So the judging criteria will be rated 5 points for each category. So the judging criteria will be to look at what's the medical, what's the solution, is the solution viable, what are the milestones, the innovative aspect of their proposition, and the people, their team, and the overall quality of the presentation. So without further ado, I think we're going to start with the first presentation, which is going to be done by Insozi Glasses, and the presentation will be Stacy.
So, good morning. The moment I was born prematurely. And my mom started having heart issues from the moment I was born. So growing up, I felt it as if it's a need for me to do a heart transplant for her. But I couldn't do it because I went into a tech school. I got a scholarship to a tech school. And my vision changed to doing healthcare solutions in tech, which led me to build glasses for people who can't afford some glasses as well. So we have the critical gap that we actually found. With 2.2 billion people in the world actually being globally impaired and needing smart assistance, and 5.2 million of those people are in East Africa, particularly Rwanda, Uganda, Kenya, and Tanzania, and the imported products are actually 600 USD, which is not affordable for local people. So our value proposition is this. We found that we can build affordable, local, and smart solutions for that problem, with 80% cost reduction, with local dialects and local languages in Kinyarwanda and Swahili, with full offline functionality and 100% data security using edge computing. So we have Inzozi glasses. Inzozi means dreaming in Kinyarwanda, where we have their smart voice-controlled glasses with facial recognition, with navigation, with visual guidance in local languages. So our proven traction is this one. We secured a grant from Ministry of Youth in Rwanda, 3,000 USD. We had a pilot program where we tested with the local people, and they 95% of them told us they were very confident using our product more than other products. And we're still in talks with the referral hospitals, with CHK and King Faisal. Our market comparison is this one. We have affordable solutions, not like Meta Ray-Ban glasses, where they don't have local language capabilities. They don't have offline capabilities as well. And standard cane, they don't have local languages, they don't have offline capabilities, and they're not smart. So the market opportunity is this one. With Rwanda, we're targeting $3.2 million. Within East Africa, we're targeting $250 million. And globally, we're targeting $30 billion. So our go-to market is this one, because these glasses are kinda not even affordable for the locals. We go to private hospitals with seamless integration into their systems, and they have sales circle, depending with public hospitals as well. And we have advocacy group with partnerships with NGOs and disability advocacy groups. And we plan to partner with government, where we have national accessibility programs for people with disabilities. So our entity is this one. Every manufacturing glass is $60, and for selling, we're going to sell it for $300, which is 80% gross profit margin. And for the cost per user via networks, we're going to spend $75 in trainings and actually local agents for what we're going to do, advertising the glasses. Our revenue break in 3 years over a customer is going to be $750. So for every customer, we're going to get 50 times return on the money that we invested. Our business model is this. We're going to sell hardware. They're going to subscribe to the updates, because they're going to have updates with the languages and everything. And we're going to have partnerships with NGOs and advocacy groups. The manufacturing plan we have is we're going to assemble in Rwanda, but we get materials from abroad. And marketing strategy is referral-based hospital trials and NGO partnerships. So our expansion is this one. 2026, a pilot phase, regional expansion 2027, Pan-African scaling 2026, 2028, 2029 is global assistive platform. So the strategic group is Mini Youth Disability Alliances, and this is our team with experiences in engineering, healthcare advisor, and marketing. So let me test our product, small. I'm going to put English, and then have a low-level prototype. And yeah. Oh. We have we uploaded 14 faces of the people. So if it sees me, it's going to say Stacy is in these centimeters away with the prototype that we have. Yeah. Can you hear me? Can you read? I think the judges are getting it. Maybe the people in the audience can come outside. I don't want to take too much time. Thank you. That was my perspective. Can I? Okay. Okay. Is it?
Congratulations.
Thank you.
This is an amazing technology.
Thank you.
And I would say any technology that, settles for people with disabilities is already a unique one on its own. So the medical lead was well defined. Your presentation was very good. And I saw you had a prototype and you tried to demonstrate that as well. So that was your milestone, isn't it?
Yeah,
Yes.
Thank you. Thank you.
Your innovation is amazing because you've factored in language barrier, as well as there's an app that would keep upgrading with time.
Yeah.
Yes. I don't really have any question regarding your presentation. Thank you so much.
Thank
yes.
you so much.
And once again, congratulations.
Thank you. Thank you.
Yeah. In our part of the world, we see most blind people on the street begging. And most of them prefer to do that easily to make money as against being very productive for themselves. What are we going to do to get adoption for such people to get used to this new equipment you are trying to bring in, knowing that they are very ready to go to the street to go and beg and make their living?
I feel like not even about the whole solution that we have. I feel like the most things we have as Africans, mostly it's a mindset change that has to come along, different people actually. Because people, there was this time I was talking with Professor Paul, and he said to me, Stacey, think big. I was like, me? I already think big. So he was surprised. I was actually surprised because it was the first time someone told me I have to think big. So I feel like some people are used to some waters, so you have to show them a different water so that they can learn to swim. Yeah, that's what I want you to do. Yeah. Thank you. It's okay.
Congratulations. Great business model, and also the target group, especially being disabled. My quick question has to do with, have you looked at any regulatory requirements? Yes, relating to that, and probably also the AR that you'll be using, whether it's an open source or you've had some discussion in relation to that. Thank you.
So the regulatory requirements, they differ depending on the countries and the health system they have. So right now in Rwanda, which is the first place where we want to test in before you can go into East Africa, it's not, Rwanda is innovative. I feel like many people know that. And I said in my PPT that we're actually in talks with referral hospitals, which are private hospitals in Rwanda, and the Ministry of Defense, because they're interested in the idea. And I showed them the prototype already, and we secured funding from the Ministry of Defense, Ministry of Youth in Rwanda. So I think it depends on the systems in the countries, but in Rwanda it's not going to be very hard for us because people are already interested. But maybe we learn about other systems when we go to different countries as well. Yeah.
very good presentation and innovation.
Thank you, Professor.
Can you convince me in one sentence why I should invest?
Why you should invest? So our product is smart, affordable, and local. So I'm going to bring you a friend that you're going to be working with and going to guide you along the way. So you're going to be able to go to work, going to talk to it, have, tell you to different places, and you're going to be very affordable. I think that's what I can tell you.
Yes, so I just wanted to ask you, you compared your product with Ray-Ban.
Yeah.
Ray-Ban is not for people with disability.
Yeah.
So I was wondering why you use that as a, something to compare with.
Yeah.
Yes. And the second thing is, have you also looked into whether people can afford a $300 tool for their eyesight?
Yeah, I talked about it in my slides. They can't afford it. Mostly these people with disabilities, they're from low-level backgrounds, and it's very hard for them to actually afford even, the glasses or even the canes. So we're going to partner with private hospitals which have short sales circles and integrate in their systems whatever product that we have. And we're going to go to the government as well, because Rwandan government is really okay with actually coming with the innovative solutions. As long as you have innovative solutions, then it's okay, they're going to take it. And then we have organizations. We have organizations, these organizations that are going to actually advocate organizations for people with disabilities that we're going to partner with. Yeah.
I'm sorry to be rude, but we have to respect the time. Thank you for your presentation and congratulations. We're going to introduce our second finalist. The company and the venture is Staying Smart Innovation, and the presentation will be made by Oma Ernest Daka. Welcome.
Has any of you ever been for lab testing and you're told to wait an hour? My name is Aoma Eunice, founder of Staying Smart Innovation. Good morning. When we took Grandpa for TB testing 4 years ago, we waited 14 days for his results. But unfortunately, TB was not waiting. He grew weaker each day, and I asked myself, why should diagnosis take this long? Did you know over 80% cases of delayed diagnosis in Uganda is as a result of hospital delays? These are not just statistics. These are patients waiting for answers. TB, like many other diseases, is diagnosed by slide staining. Across Africa, lab technicians still manually dip samples into staining and rinsing solution, one slide at a time. Yet they're working on hundreds of samples per day. This overworks lab staff, increases the risk of human error, and delays diagnosis. Existing stainers are very expensive, require high maintenance, and the spares are even hard to find. That is why we built LAS, an affordable, low maintenance, and fully automated slide stainer that can process up to 30 slides per cycle. It is versatile, performing tests on several diseases, and can be powered by both electricity and battery. Future integration of machine learning model will further enhance its diagnostic capacity. We've so far raised $11,000 in seed funding, conducted prototype development and user testing at expert laboratories. Feedback from this was integrated as we designed our minimum viable product. We've signed an MOU with Dora Electronics to further refine and produce several units of glass. While existing automated slide stainers are consistent, they are very expensive. Manual staining, on the other hand, while affordable, lacks the consistency, scalability, and integration of advanced diagnostics. LAS is our own, yes, our own homegrown solution that does not only stain, but diagnoses. Across Africa, South Asia, and Southeast Asia, over 150,000 laboratories perform microscopic diagnostic, a total available market of $600 million and serviceable available market of $452 million. Initial deployment will focus in East Africa, targeting a serviceable market of $18 million, and we believe within the first 5 years of operation, we'll have captured 10% of the SOM, targeting both private and public hospitals, research and academic institutions, and clinics. LAS is a commercially viable product that integrates multiple revenue streams, including direct sales, installation, repair and maintenance, and sales of spare parts. Our go-to-market strategy follows a simple three-step process. 1, we enter laboratories through pilot programs, identifying early adopters, whom we have already identified. Once we've proven value to them through cost savings and efficiency, we believe these will convert into contracts and scale through case studies, partnerships, and exhibitions. We are currently raising 250,000 Canadian dollars, and our strategic ask of 15,000 Canadian dollars will enable us to do clinical validation. We have engaged administrators at Barra Regional Referral Hospital and expert laboratories, and a letter of intent has been signed to enable us to conduct clinical trials. We are also optimizing our design for manufacture. Next, we shall conduct business development, seek regulatory approval, and launch our product into the market. We are a multidisciplinary team from biomedical engineering, computer and mechanical engineering, and advisors from medical laboratory and business. Partner with STEM Smart Innovations today, and let's reduce the weight, the disease burden, and most importantly, save lives. These are our contacts. Thank you. So the machine works by plugging it on the power source, and so it dips. So this is the slide. Okay, this is the slide. It can dip to. So now, my switch broke, but it's okay. Yeah, so through this panel, you can select a number of disease. Demonstrate one. Oops. I do this a lot of times. I'm a biomedical engineer. screen.
All right, so that was a great presentation and your attempt to bring about a good innovation. So my questions were regarding the staining. You showed a mixture of gram staining and Zn staining. They all have different durations for staining, and they are all different for different conditions. So I was wondering if we were going to mix all these different stainings at one time, and that would not be possible. And what did you have to say about we now moving into rapid diagnostic tests? So you brought conditions like tuberculosis, malaria, and stuff, but we hardly stain for TB or malaria or, you know, other common medical conditions. And the third one was, you said you were going to bring on AI-powered image analysis. Could you describe everything to us? Thank you.
Okay, thank you so much. So how the machine works is there are programs that are put in here. So you select the program. Through that program, you'll need to change the different containers here. For example, if it is malaria and you're using the field stain technique, then you put, if it is malaria thick, you'll put field stain A, water, field stain B, water. So you change the containers. If it is TB, then you change it using the gram stain technique, you change it accordingly. So you will not mix it. So that's how it works. Then you talked about the RDTs, the rapid diagnostic test. The beauty about RDTs is that they're supposed to chase people from their comfort, from their homes. They're supposed to push them into the hospitals. But WHO still recommends microscopy as the standard for diagnosing malaria and TB. So that's why we're still, and then across many hospitals and laboratories in Uganda, this is the technique that is still used, because you find that these diagnostic tests, laboratories have to keep buying them, but this is a one-time machine that I'm going to buy and use it all for over 30 years. Yeah, so.
Yes, congratulations once again for that good presentation. I'm thinking about competition. I'm sure there are already well-established companies, manufacturing companies doing things better, and they've been in the market for a very long time. How do you intend to get this innovation into the hospitals, especially when they are used to other methods of doing what you want to do?
Thank you. So if you remember my competitive analysis table, I even highlighted Leica Biosystem, which is like in 1% of the hospitals in Uganda. It is only the pathology lab that uses Leica systems. So yes, the competition is there, but their systems are not built for our settings. For example, if a machine has to run on power every now and then, that means a rural health facility will not use it. So we've identified the competition, but we're not just building a product. We are building trust with our users, and we are building for them efficient systems that can be used in whatever environments that they're in.
Okay, very quick one. Congratulations once again. Most machines in Africa, mostly imported, have issue with after-sales service and having to fly people from different countries to offer that service. With this, have you taken that into consideration?
I beg your pardon?
Service when there's breakdown or something in that aspect.
So servicing the machine, so that's why I said the machine is low maintenance. It is designed by, I'm a biomedical engineer myself. So I go into hospitals, I know what it means for a machine to fail. I know what it means when a machine is there and I cannot repair it and they have to call someone. So that servicing has been put into consideration to ensure that the available biomedical engineers within Uganda, within Africa, can actually go there and service this machine.
Thank you very much for your presentation and for the technology that you've developed with your team. Congratulations. We are now going to the next presentation. Can we? Okay. So our next presentation is going to be made by Agasha Faith and Maria from Pearl Oxy.
Hello everybody, my name is Faith Agasha, representing Pearl Oxy Uganda, where we save lives by delivering oxygen to patients during power outages. Paul here is a 3-year-old child who has been admitted to the hospital suffering from severe pneumonia, and he's connected to an oxygen concentrator to help him breathe. 2 hours into his admission, power unexpectedly goes off, cutting off his oxygen concentrator and ultimately his supply. There are no backup solutions in the hospital, unfortunately, and because of this, Paul dies. Paul represents just one of the 15,000 children in Uganda suffering from severe pneumonia annually who are dying because of these power outages. And yet pneumonia is just one of the many conditions that will require oxygen as a first-line treatment option, meaning that across the health sector, the problem is bigger. In Uganda, 57% of our oxygen supply is provided by these machines, but they depend on power to function. And yet 64% of these same facilities will report experiencing daily power outages, averaging about 2 to 3 weekly power outages. Oxygen concentrators are the most common source. They depend on power, and they experience a lot of wastage during their use. What do I mean? You'll find that these machines can produce 10 liters of oxygen every minute, but patients are only using between 2 to 5 liters of oxygen usually. So every minute this machine is in use, 5 to 8 liters of oxygen is going to waste. Oxygen you could otherwise have used to save another patient's life. Alternative solutions like cylinders have high transport and refill costs, making them not sustainable. Backup solutions like the generators and the UPS systems and the solar systems have high initial and maintenance costs, and they are fuel dependent. All this shows you there's still a lack of automated oxygen continuity, especially during power outages when it is the most critical. That is where we come in. With a medium pressure oxygen storage system, we are able to add the storage component to these already existing oxygen concentrators to optimize their performance. With our system, we create a buffer between the oxygen concentrator and patients like Paul, so that when power is on, our system is giving the patient what they need while storing all the excess that is being produced. And when power goes off, our system is able to automatically give the patient the reserve to ensure continuity in his supply. Our system can hold 2,000 liters of oxygen for a period of 4 hours and serves 4 patients at a go. With our system, we also offer real-time monitoring to help these healthcare workers to be able to effectively manage these individual oxygen needs, especially during power outages when it is the most critical. Our system workflow is built off user experience, offering an initial easy plug-and-play setup and connection, continuous monitoring for the healthcare workers, and improved recovery because these patients are not affected by the frequent outages. Our benefits of our system include automated and seamless immediate oxygen during outages, readily available fuel-free oxygen bank in the hospital at all times, and it is easy to integrate into already existing infrastructure like the oxygen cylinder concentrators. We are the best on the market simply because we are not trying to introduce a new technology, but simply improve what is already in the market, offering a fuel-free, automated, seamless backup solution for power outages with no cylinder refill costs and automated 5-hour backup regeneration, which are absolute game changers for the ecosystem as it stands. Our market opportunity is $1.2 billion large. We start in Uganda, but through website engagement with a distribution company in South Africa and a children's hospital in South Sudan, we realize our problem is continental, so is our market opportunity. Our business model is simple. We sell the MPOS units for a one-time purchase and have recurring revenue through the software and our prepaid service contracts. And our go-to-market strategy is to sell to private hospitals first, prove our value, and use that data to unlock the bigger institutions like the government procurement programs and the global health donors. And you may be wondering what we have done so far. So in 2022, we built our first proof of concept prototype as undergraduate students, validated the science, and with that, we won a grant in 2023, graduated from the Founders Institute program, learning how to run a medical business. We began patent registration, and we are currently patent pending, and we have improved our prototype design. In 2025, we have engaged multiple stakeholders like the hospitals, the Ministry of Health in Uganda, and the FDC office under the British High Commission. And through the government interests, we have become members of the National Innovation Hub of Uganda. In 2026, we are moving into piloting the new prototype design and are currently partnered with WERA to build the unit we will plan to test in the real world. Our team is made up of biomedical engineers at its core, and we are supported by an independent advisory board with over 20 years of experience in finances and technical oxygen systems. This is some of the work we have done over the years, and we are currently raising 250,000 to support our runway, our 18-month runway in product development, pilot testing, certification, both local and international, and in operations. And with the 15,000 would win here today, would invest it in product development and pilot testing, which are our current needs. I believe that no child deserves to grow up unhealthy regardless of where they're born. The last sound Paul made in the hospital is something I will never forget. It is why I started Parlox Uganda and why I encourage you to join me on this journey today. Thank you.
Yeah, so congratulations. So I wanted to find out if it's an innovation.
Yes.
Because I've seen this system in other part of the world. So yes, so this is a medium pressure oxygen storage. So it's like a power bank.
Yes.
So when you don't have oxygen supply that needs a power supply, then this power bank gives you the backup oxygen supply.
Yes.
So basically this innovation is, is all over the developed world. So maybe I would say that it is an innovation for the, the developing world. Yes. So my question was, where in this innovation does the app come in? Because this is about the power bank. So where is the app coming in?
So
Thank you.
basically, because the innovation, it's still an oxygen storage system, the healthcare workers need to be able to monitor. One of the challenges we continue to face is that we are not able to monitor the supply, which is why these hospitals are not readily prepared for the emergencies of oxygen concentrators dying during servicing of patients. So our system is able to monitor the tank pressures, monitor how much supply is left to help the healthcare workers be able to prepare for the eventuality, because she's dealing with 4 patients on this machine at the same time. So basically, we have created an automated system with sensors and safety controls. So all she has to do is log into her phone or the computer to be able to access the information about how the system is running, if the oxygen concentrator is still on, and the individual needs of these patients, like if they need more, if they're receiving the right amount of supply through their channel, and basically that's it. Yeah.
But I still wanted to ask you, do you think the app is necessary? Because the storage can only keep the amount that it can keep.
Yeah.
So you don't need an app for that.
It's basically just to help her to, one of the challenges we have, and one of our unique selling points is that through this app, the hospitals are better able to prepare for the eventualities. So one of the things we, as biomedical engineers, we have seen is that hospitals acquire either too much or too little of their oxygen supply needs. So our system is not trying to replace what's already on the market. We just want these hospitals to be better prepared. So in the eventuality of the power outage, the nurse doesn't have to now scramble. She just has to look into the app and see what the individual needs of these patients are and see how much supply they will need. If she realizes our supply is at 80% complete, but power is not yet back, at least now she has time to look for the oxygen cylinders to connect these patients. And with continuous assessment of this data, hospitals are now able to better prepare monthly for the oxygen cylinder needs they will need, and also for the oxygen concentrators they may need to acquire to strengthen their oxygen access at all times. Yeah.
Very technical. Very technical. All right, so you mentioned 2 things I want clarity on. One is that you wanted to start selling to private hospitals first. I want to know why. And then number two, has this been validated in terms of standardization in your country? Have you gone through all those processes to make sure that it's validated and accepted?
Okay, so the reason we picked private hospitals first is a very strategic one. Private hospitals are early adopters, and they have shown more interest at the moment in acquiring this technology. So we plan to use them as early adopters, generate the data, show the value of what we have built, and use that data to be able to, because for them they are able to consistently afford the recurring monthly costs, but government hospitals are governed by these longer term contracts. So at least with the data we generate, we'll be able to move into a different business model with our government hospitals, where we give them these maintenance and website subscriptions at a standardized fee for a longer period of time, because they will not be willing to pay recurring costs monthly. So that was a strategic reason we picked private hospitals first. So for standardization, we have done in-house testing of our first prototype, and with that, we have basically improved our design. So in 2026, we have been working on the new prototype design with wearer electronics, like I mentioned, and because they have experience with building and piloting prototypes, that was the interest in why we wanted to work with them. So we have built our system based off ISO standards and IEE standards, which are the international standards for medical oxygen systems. Yeah.
We will not have time for another question, I'm sorry. So thank you for your presentation. So now we're moving to the next presenter. The next presentation will be done by Grow With Me, and Hannah is going to do us the honor of presenting her venture.
Good afternoon, everyone. I am Hannah Pranut, founder and CEO of Grow With Me Prostheses. Imagine buying your child a beautiful, expensive shoe, and suddenly overnight, he grew, and those shoes become painful walk. Meet Aman. Aman is a child who lost his leg at only 20 months old. His mother, during a war, his mother fought for him, but the system failed them both. But Aman is not the only one who suffered from this. Every 10 minutes, a child joins him. A family pays a prohibitive cost, and kids wait for their prosthesis up to 3 years, and they face a painful recovery. But the ultimate trap, rapid growth. Every 6 to 12 months, a child outgrows their prosthesis, and they're going to have to go through this cruel cycle every time. The pediatric prosthesis market is globally pediatric prosthesis market is $2.2 billion, and Africa it talks up to $300 million. And we want to focus on Ethiopia, which took up to $50 million, and specifically Tigray because of the war. Our solution is simple. We want to provide a prosthesis that's affordable and can grow with the kids, unlike the existing product, which requires a lot of production when the kids grow. Our technology consists of all mechanical product and adjustable and also modular. It combines adjustable socket. It combines adjustable socket, telescopic pylon, polycentric knee, and extendable foot integrated with spring. our product combining adjustable circuit, telescopic pylon, polycentric knee, and extendable foot. And our patent pending. Currently, we're prototyping at Addis University Biomedical Design Studio, and with FemSTEM backing us, we plan to secure FDA approval, EFDA approval, and we plan to launch our market. And early on, we plan to address a private hospital and public organization. We plan to generate revenue through service. We plan to through prosthesis sale and maintenance in partnership with NGOs and upgrades. Our startup was founded in October 2025, and we was able to make our first prototype in January. We become a full team of 5 in February, and we were able to be selected 2025 FemSTEM Africa in April, and we're currently working on our latest prototype. We're backed by a beautiful, consistent team, which contain biomedical engineers, mechanical engineer, and health professionals. We are advised by experts, including the president of Ethiopian Prosthetic and Orthotic Association. Look at this child smiling, standing tall. Where grow with me prosthesis, where little step become brave journey. Thank you.
Okay. Grow with me, that is it, isn't it? Yeah. It has to grow with you. So it means you don't, I'm not too clear. Do you do it and the child start wearing it and it grows with the child? What does?
The child is going to wear it and it's going to be adjusted.
So it will be increasing as the child grows. The leg will be as the leg increases.
Yeah.
The prosthesis also.
Yeah.
That's what it is.
That's going to be mechanically. It's going to be adjusted as the child grows taller and also wider. Yeah.
So this is made to fit. Is it made to fit every child? So how long does it take to produce one?
It's going to take up since some of the parts are going to be 3D printed, just like a day. I mean,
a day.
For one, just a minimum.
Congratulations, grow with me. I have 2 questions. First is competition in terms of competitor analysis. I wasn't sure whether you touch on the price and how competitors are offering and to be competitive for the in terms of your target markets. Then US, the source of the raw materials and whether it is in Africa and how for you to get. Thank you.
Okay, we're going to get the materials locally, so we're going to use the materials we can find in Ethiopia. Also, what was the other question? I'm sorry. I couldn't display in here, but I already have the slide. Our product is very affordable. It's going to be up to $500. So since we're going to make it using local materials, and it's going to, some of the parts are going to be 3D printed, it's not going to need any oven or other materials to be done. So our product is very fast fitting and very affordable. So it's going to be easy for the people who are going to use it.
All right, so Yeah, so that was a good attempt, but I wanted to tell you that prosthesis is not new in the system. And I also wanted to find out if your product is going to be adjustable or also having the air and vacuum technology as well.
It's not going to have the air vacuum system,
Yeah.
but the circular part is going to have its own magnet, so it can be. It's going to have a magnet with it, so it can be it's going to be adjusted with the residual limb. So it's not going to need any vacuum system. So yeah.
All right, thank you.
Thank you very much for the presentation as well. I saw a lot of moving parts in the adjustment. Is that correct? A lot of parts to be fixed together, right?
Yeah.
Can I see the slide with the prototype? Yeah, here. Is this a typical product that you have, all these parts?
No. The other one, the first one, it's every basic prosthetic device have those things, all those things. The only thing we add is just the adjustable pylon, so it can be extended since it's telescopic, and the extendable foot, so it's going to be extended as the other foot of the kid grows. It's going to be adjusted as the other one. So
Okay, so my fear was if there are these moving parts to the same thing, and you see the way kids will play, if he falls down or something happens, don't you think that any of these parts are going to hurt the child? Because once the child feels comfortable using it, they may be playing around with it.
Yeah.
Won't it hurt them at any point in time?
So as I told you before, those things are already, the existing market, they already have it. Some of those parts are knee and foot. So that's the basic thing. So our product is very secure. As it have its own gear system and screw system, so it won't lock. It will lock, so it won't fall or it won't fall apart or anything. So yeah.
Thank you very much. Congratulations to your team. So, going ahead, moving to the next presenters. Our next venture is going to be One Click Med, and I'm happy to introduce Faith, who will present her venture. And again, please, I would appreciate if you could maybe make some silence while the presenters are talking, and even when they are answering the judge's question. It's really a special moment for them, and we really want to help them get the best conditions to present.
Thank you. Okay, there are things you hear about and think, that would never be me. That was me 3 years ago. That woman right there is my mother, and what happened to her changed everything. She was going into surgery. It was a corrective arm surgery, so I thought to myself she would be fine. But surgery didn't happen that day because her records couldn't be found, so they asked her to wait. She waited through the afternoon, through the evening, through the night, in pains. It was suffering for her, measured in minutes. I paid twice, I stressed twice, but she hurt twice. The hardest part was sitting next to her, not being able to fix it, knowing that somewhere in that hospital, a file existed that could end her pain, but no one could find it. She went into surgery the next day, and standing in that hospital corridor, I asked myself one question: how many people are going through this right now? Not because doctors failed them, but because a file had gone missing. My name is Faith Taiwo, and that's why I co-founded One Click Med. And here's the problem. 80% of hospitals in Africa still rely on manual records, with patient medical histories scattered across multiple facilities, and zero data transfer capability between these hospitals. And here's what we built: an end-to-end digital health ecosystem. And here, a powered EHR system built on FHIR standards to ensure compatibility across health networks, with flexible architecture connecting labs, pharmacies, and insurance providers, allowing for secure flow of patient information between different healthcare facilities instantly, empowering patients with real-time access to their medical histories. Then how it works. A patient visits a facility, reception creates profiles and enters vitals into EHR. Encrypted medical data syncs instantly into a secure cloud via an API. Patients can view records, labs, and link hospitals in real time on the Better Health Hub. Data is available instantly at the next facility, preventing gaps. Here is what EHR looks like. We have digitized paper records, automated billing, inventory, and staff management. And for the Health Hub, we have the real-time health record access, offline functionality. For the premium services, we have emergency response services, direct lab result access. And the business model, our B2B SaaS model costs $80 per hospital license per year. Our B2C is 15 to 30% commission fees, emergency response services from telemedicine and lab access. Our unit economics, our customer acquisition cost is $150 per hospital user. Our LTV to CAC ratio is 16:1, and our payback period is 7.5 months. Our market opportunity. Total addressable market is Africa's $5.58 billion digital health market, out of which we extracted our serviceable addressable market, which is Nigeria. Our serviceable obtainable market is Lagos and Abuja, and we want to achieve 10% of that in the next 5 years. Our unique value proposition. First, we have, unlike silo system, we offer a complete platform combining hospital EHR, patient hubs, and third-party integration. Next, we are built for seamless integration. We integrate seamlessly into whatever infrastructure a hospital already has, rather than forcing an expensive replacement. Third, we are engineered specifically for offline first capabilities and low bandwidth. And this is specifically important in Africa with a lot of underserved communities, premier healthcare centers, and low resource communities. Our competitive analysis. We have other big players in the field, but currently, OneClickMed is the only platform that seamlessly connects hospitals and patients on one platform. And that's why we stand out. We are bridging the gap between affordability and high-tech integration. We've gained some traction since we launched. We have 3 hospitals fully onboarded and using our EHR daily, plus a secure partnership with an health group, giving us 30+ access hospitals in their network. We've digitized over 3,200 records, have over 650 people use our Better Help to access their health records daily. We've gotten 85% satisfaction rate from our customers, and we've been able to raise $20,000 in pre-seed. Our team has a combined experience of over 50 years. I am a pharmacist with over 5 years of experience in patient care innovation, product management, and digital health. And our CEO is an IT consultant with a decade experience. Our ask, we are on a $100,000 mission to scale OneClickMed, and a 15,000 Canadian dollars price today will be a lot for us to accelerate our mission. My mother waited 24 hours in pain because a file couldn't be found. Somewhere in Africa right now, someone's mother is waiting too. The difference between our story and my mother's story is how far we scale what's built. So help us scale it. Thank you.
Yeah, congratulations, Faith.
Thank you.
Done with your presentation. Yes, but I have some comments. This is not something that is new. Yes. We are already using it everywhere, even in.
Okay.
Correct. Is being used by more than 50% of hospitals in low-income countries. And my second question is AI diagnostic support. How does clinical
Okay.
And the third thing is the third-party integration. Okay. It comes with a lot of legalities. Yes. So how are you able to tackle that? Thank you.
All right. Thank you so much for the questions. Okay. So for the first question, we have, just like you said, we have a lot of EHRs, but like I said, they are siloed systems. They only work for the hospital. So what we built is something that can work for the hospital and then also for the patient. So on the patient side, they can link their hospital in real time on the Better Health Hub. That's the mobile app. So once you go to an hospital, you have your health records in your mobile app, and you can link it to that hospital. So the hospital does not have to ask or reach out to another hospital. Because in Nigeria, we have a lot of transfers. People are transferred from one hospital to the other, and the system are not interoperable. They don't talk to each other. So in a case where the patient already has his or her medical profile on the phone and is going into another hospital, you can link it on real time, and you can also have access to your records. Another thing is emergency care services. So we have partnership with ambulances in Nigeria. So when there's a case of an emergency, you can do it real time on the stuff. Then on the AI support, it's purely analytical. It's not so it's really it doesn't make diagnosis. So public should have been analytical. It's purely analytical, so you can see what the data looks like and just suggest, okay, from this patient's history. So it doesn't really do anything real time, purely analytical. So that's how it works.
I'm just asking myself between the patient and the hospital, who really needs to know their medical record updated at any point in time?
Yes, so between the patient and the hospital, first, what we noticed is Nigeria is in the hospitals, they really need to know the record as well as the patient. But in the case of the patient, we've had cases where patients are delayed for operations because they don't have a record of their allergies, just allergies. I'm allergic to ibuprofen, and you don't even know it. But when you've been to an hospital, when you've identified you with that, but it is in their paper, but you don't have it here. But you have a system where you can record it on your mobile app. Then when you go to the other hospital and say, what are your allergies? You don't have to rack your head and say, okay, I don't know what they said the other time. You go to your phone, you check your records, you see your allergies, and you say ibuprofen. Okay, I'm allergic to ibuprofen. Then you can inform the decision for the doctor. So as much as it's important for the patient, it's also important for the doctor. Because in Nigeria, pregnant women die because they have allergies. And the next system did not even know it because the system don't talk to each other and they are not interoperable. But with this, they can achieve it.
In that case, won't you agree with me to position this product to target the patients much more than the hospital?
Yes,
because
that's why. Okay.
Yeah, because if I know my...
Sorry.
Ready for a 15,000, right?
What do you say?
You're ready for a 15,000?
Yes.
You're ready for it?
Yes.
All right.
Yes, sir.
So I'm just thinking, why don't you position this product to target the patients more than the hospitals? Of course,
sir.
the hospital will need it.
Yes.
But if I have my record on my phone,
Yes.
at any point in time, I can produce it to anybody who needs it.
Yes. Okay, yes, so thank you so much for that. And then we are working with that. And that's why we've had over 650 people registered on the mobile app and using it every day. Because once they see it's beneficial to them. They tell their family members, you have to record this. So even parents that have children that are going to school, they can record it on their phone. And when you get to school, you want to take a medication, you say that, no, I am allergic to this. It's on my record. I can see it here. And then it goes like that. So basically, we are targeting both the patient and the hospital. But the hospital gives us a leverage that when their patient comes for consultation, they can introduce the app to them and say, your record is here on our file, but it's also electronically. So anywhere you go, you travel out of the country, they want to know your allergies, then you can see it here. So it works both ways.
Thank you very much, Faith. Again, congratulations to you and your team. We're now at the last presentation for the afternoon. I'm happy to introduce Diana, who will talk about Hacky Labs innovations.
Two months ago, Aisha was sexually assaulted. She did everything right. She reported to the police, went to the hospital, had DNA matter collected, but the system still failed her. The DNA collected needed cold storage for it to be viable by the time of testing, but due to a huge backlog at the government chemist, this was not possible. The perpetrator walked free, her pursuit to justice stopped, and that is how Aisha is here today. She is not a story, she is a data point, representing thousands of survivors across East Africa every year. To prosecute sexual assaults, you need several aspects working together. You need survivor cooperation, clinical response, law enforcement, and forensic evidence that will hold case at the end of it. However, due to Africa's heat that we've been experiencing even here today, DNA degradation happens so fast. And broken chain of custody is another problem that we're trying to handle. So we have, as I've mentioned, that different players in this chain system, and most of them still rely on written notification. So a kit comes with a paper, and all these are collected in manual papers. So anyone can tamper, can enter erroneous data, or can decide to even take the DNA. So by the time you get to the court, even if there was valid DNA evidence, the accompanying records make it invalid. This leads to the numbers that you're seeing here, 72% unreported cases. Less than 15% of those end up not having a conviction. And the cost of existing kits is up to $350. As I mentioned, degradation is another problem. So that is where Haki Labs has come in. We have worked with Zymo Research's DNA stabilizer to come up with a climate-optimized evidence kit that preserves DNA for up to 14 days at 40 degrees Celsius without cold storage. With cold storage, this can go to up to 5 years. An offline digital tracking system that is able to generate instant reports for the court at the end of all this process. This is how our data tracking, digital tracking system works. So one, you're able to scan the QR code from the kit, then track the GPS, upload a photo of what you've done with the kit. So if you're a nurse, you're the one who collected a sample, you take a photo and it is attached there. Then there's a signature of who was the one working on it. The same way you get a financial statement that no one can tamper with it, there's a report at the end of it that is tamper-proof that is presented to the courts. Healthcare workers have mastered this within 30 minutes. We've been able to validate this with hospitals. And we are currently the only sexual assault kit provider that are doing all these things. That is digital tracking, court-admissible tamper-proof reports, climate optimized. They work offline and they still have a cheaper price point compared to the imported alternatives. Our market opportunity. So in Africa, there's an estimate of 300,000 sexual assault cases reported annually. That is what we're aiming to get to. But we want to start with Kenya with 15,000 cases, and that will give us a 3 million addressable markets. Our business model is starting with private hospitals, so that is going to be B2B, and then we'll go forward into the government hospitals. Remember, our kits are not for the sexual assaulted survivor, it's the hospital and the nurses. Then our financial projections, as you can see, will break even at the second year of operation, that is 2027, and we'll have sold 2,000 kits. This is where we are. So we've been able to develop our prototype, acquire the stabilizer from Zymo Research, we've done the market research, and now we are at validation. Hospitals have validated us. Business registration is ongoing, given the regulations that are in the data we are handling. This is not something that we can rush. And with the 15,000 from today, we'll be able to accelerate this and continue into continue helping sexual assault survivors. So yes, we need this to move to our next step. The team behind this is Aidana Mulinge. I'm the CEO. I lead strategic, advisory, innovation, and business operations. My co-founder is a forensic expert and a GBV coordinator. And we have our software development team that has built our digital tracking app. These are our partners who've helped us in our development, and we'll be working with Nkrumah Biotech for the assembly. Thank you.
That's amazing. And you are actually tackling a great social problem, so this is good. Yes, you mentioned some data. Still say that they are still hidden data because they are not reported because of stigma. So you still have huge numbers, and not only older women but even children. Yes. So DNA that you are going to preserve for 14 days. Give us the technology behind it.
Okay. So as I mentioned here, we've acquired the stabilizer from Zymo Research. They have a DNA stabilizer that does not need cold storage. So once a survivor is swabbed after they've reported, you break the swap, have it in the, yes, and then it does not need cold storage. So that gives enough time for it to leave the hospital, go to the lab, and they can still test it, and we still have 98% of the nucleic matter for sampling. Also, the swabs that are used are flocked, so we have 3 to 5% more DNA collected. And given the labs that we have in Africa, they're not able to rely on soil samples, nail clippings, so we need to make sure the DNA is in perfect condition at the point of testing.
So the preserver, was it your creation or you are relying on someone else's technology?
We are relying on someone else's technology. We are not able to produce it currently in-house, also because of the cost of production. But that is where we aim to get to. We just need to make sure the kit is available right now.
Well, the concept is good. That is good. Yes, thank you. Yeah.
How do you intend to get the unreported cases? Because there are lots more cases that are not reported, and that need attention. How do you intend to do that?
So, court reporting is, case reporting is a mental model. As you said, there's stigma around it. There's people who are afraid to come forward. One of the reasons that we identified is because we believe, most women believe, the system is not going to work for me. So if I can create confidence at the point of 200 women reported cases this month, and there's been conviction of 200 cases at the end of it, then there's one person who will sit and feel, I can come forward because the system is now working. That's why now we are coming at the point of bring a kit that works, a digital tracking system that works for them, and then more people will feel that their voice is not going to be shunned by the place they need to go and report.
Thanks and congratulations.
Thank you.
For evidence, acceptability of the evidence is key. So how are you getting the various agencies, especially the security agencies, the courts, because it's not just providing the evidence, the legal, you have to be dealing with that to get that credibility and traction from that point. My second question has to do with the figures in terms of costs. And probably I saw the 200 or so, but comparatively in terms of the others, I didn't see whether they are offering 500 or 600. You have put 200.
Sorry?
The cost, yes. Okay. You put 200 or so. How does it compare with your competitors? Although I realized that there were a lot of red. They will provide.
Okay. So one, because there's different players in this system. So once someone reports, they report to the police. Then you go to the hospital, you get your DNA, the sample is collected. So everyone that is handling the DNA is in our tracking system. They scan the kit, input what you did with this patient, with the survivor, and then we get a report at the end of it also. Once the DNA has been taken to the government chemist and has been tested, we also get a report of this was done by this person at this day, and it is GPS and time-stamped. Then that makes sure that the police cooperate. They cannot change the story. The government chemists cannot delay sampling because they have other things to focus. So we are trying to hold everyone accountable with our digital tracking system. I need to answer the cost question. So I just put this slide here. So the imported kits, they are still expensive because one, they come with extra components that our labs are not able to handle. So they come at $350. Also there's importation costs, duties, and freight. All those things make it more expensive. That is why we still compare as an affordable option for the hospitals. No. No. No, we've not sold, but we, sorry.
Thank you. And again, I'm so sorry I have to be rude, but we have to be fair with everybody and give the same time. Thank you so much. That was a great presentation. And a round of applause again for all our participants. So we're moving into the deliberation session from the judges, but while they're deliberating, I invite you to meet our 6 finalists. Talk to them. It's an opportunity for you to exchange and get some feedback and collaboration and contacts and networking. So I invite you to stay in that room, and maybe we can split yourself into different corners of the room, and then you can have those conversations while our judges are going to deliberate in another room in the level below. So Princess is going to guide you to the deliberation room. I think
just a big motivation. Professor Wilberforce this morning urged you to not leave this room without networking with people. So your mission in the next hour is to speak at least to 3 of the presenters. Everybody in this room, speak to 3 of the presenters. Ask them the question that's going to put you on this stage next year somewhere else in Africa. It won't be back in KNUST. You'll get a chance for an all-expense paid trip somewhere else in the country. So please do that for us. Thank you.
So I have the 6 ladies up here. They're gonna stay in the front here, spread across the room. Make sure you come up there and talk to each of them and do your networking. Thank you, everyone.